All right, we want to welcome Chief Nim Kidd. He's with the Texas Division of Emergency Management. Chief, thank you for taking time to speak with us. I know you're extremely busy, especially what's going on. I mean, you turn on any of the national news, and Texas is right at the center of all of the bad news. Where do we stand right now in terms of this pandemic?
So Ryan, thanks for having us today, and really we appreciate all that you're doing to help us get this message out. I mean, it is no secret that Texas has seen an increase in the number of positive cases and the number of hospitalizations and the number of people going into an ICU. I think the other message that we need to get out is we still need people to follow the rules and the suggestions of all of the healthcare providers and physicians that are out there. We still need people to wear the mask in public. We still need people to keep social distance and isolation. But Ryan, the one thing I want to try to get across today is we need to do that when we're in our homes also. As you know, I'm a lifelong San Antonian, grew up there, worked there for many years, and I know how many multi-generational families that we have. And while we believe the community is doing a great job of following the rules when they're outside of the home, we really need to be thinking about doing the same thing when we're inside the home. I mean, all of us are capable of catching this disease. None of us are immune from this. And the fact that we need to get across is in order to protect ourselves, we need to protect our families and our loved ones. We really need to be thinking about the care that we're providing inside the home right now to make sure that we're not spreading this disease inside the home and then making it come outside the house.
So let me get this straight. What you're effectively saying is that people should be wearing masks inside their own homes now?
Ryan, I'm saying if you can't socially distance and can't socially isolate, or if you've been out in public and exposing yourself and you haven't decontaminated yourself good enough when you get home, if you have someone that has underlying medical conditions at home, we really need to be thinking about that. Now, if you're the same 2 or 3 people that are living in the same house and you're really taking care of yourself and you're following all the rules, then you probably don't need to wear a mask in your home. But if you've gone out for Memorial Day or 4th of July, or you've gone out to parties, or you've gone out to graduation parties, when you've gone out and you've come back in, you can be bringing that back inside. And I think it's no secret, we all like to relax when we're at home. But if we're not paying attention to how the virus spreads outside or inside the home, we're going to keep spreading this virus. And so while I'm not necessarily saying you must wear a mask at all times when you're in the house, I want you to think about where you've been. Have you done the things to protect yourself and your family when you're at home? And when you have extended family coming to stay with you, are you doing all the things that you can to protect yourself and them from this virus?
Here in Bexar County, we know the hospital capacity has been hovering anywhere between 10 and 15% of beds left. How dire of a situation is it in Bexar County, and what would it look like if we called on the Infectious Disease Center in Bexar County to step up and help take some of the patient load?
So Ryan, as you know, you have world-class healthcare in San Antonio and Bexar County, and a lot of great partnership there from years of working together. Statewide, we still have over 11,200 general hospital beds available and a little over 950 ICU beds available. Now, those are licensed beds, not necessarily staffed beds. And so while you're talking about the percentages of beds that are available, we still have the capacity to add additional staff inside of the hospital to be able to accept additional patients. Across Bexar County today, about 31% of your people in hospitals are there because of COVID-19, and about 66% of the people in an ICU there are because of COVID-19. But that's the available beds and the available space. We will continue to work with your local partners, our local partners, and our federal partners to send in additional staff to be able to staff beds inside the hospital, because we believe that's the best place to get the best care.
President of the United States and the White House and many, many others are pushing for students and parents, for everybody to get ready to go back to school in the fall. Where does the state stand on this issue? And do you believe the science backs it up that kids really aren't spreading COVID-19 and they should be getting back inside the classroom to learn?
So Ryan, I'll tell you that over the last couple of days, maybe weeks or so, we've been working with the Texas Education Agency to be sure that we're pushing personal protective equipment out into schools to be ready for school to start. I think Commissioner Morath of TEA, at working across the state with the superintendents, will have safe places for our children to go to once school does start in the fall.
Do you feel like we're in a second wave? Do you feel like this is still part of the first wave? Should we anticipate cases to continue to rise as we get closer to the fall and the winter months? Where do you see things headed?
Yeah, Ryan, right now I think it's hard for me to actually tell whether it's a continuation, first or second, third wave. I think the message that I really want us to get out there is we know we can bend this curve. We've proven that we've done it in the past. I think we're going to prove that we're doing it right now, but we have to do that smart. We have to be very cautious about that. The way that we do that is by everybody protecting themselves from the virus and protecting others from the virus, just by following the suggestions and the rules that our elected officials and healthcare professionals have put out there. I think this virus will be with us for a while. I think eventually they will have a vaccine. I think we will come up with all kinds of metrics and methods to reduce the chance of spreading the virus and to help make ourselves return to better faster once you get the virus through pharmaceuticals or other medical interventions. But the important part that we need to say is we know how we can keep ourselves from getting it, and we need to follow those rules.
Chief Kidd, we appreciate your time. Thank you for everything you're doing.
Thank you. Likewise.